right. What is the most likely cause of this patient's fever and X-ray finding? A 70-year-old woman undergoes total hip replacement surgery. On post-op day 2, she develops a fever. Her breath sounds are decreased in the left lower lung field. Chest X-ray reveals linear opacity in the left lower lobe. Okay. I always get these confused. A linear opacity, lower left field. She's 72. She's in the hospital. Has a fever. I like pneumonia, but linear opacity. I guess that would be like the interstitial pneumonia. I'm trying to think exactly which pneumonia it would be. Not that they're asking this.
Mhm.
You could always have a PE with older woman like this.
Mhm.
Pneumothorax, I don't see too much evidence for linear opacity. Linear opacity. Yeah, a PE is like would be circular. Yeah, I like sort of like that interstitial pneumonia. Um, it also could be bronchiectasis. I always get confused on these words. I was just doing this earlier today too.
What's your gut say?
My gut says pneumonia.
Okay. Final answer.
Yes, final answer.
Okay, so let's work through this here.
Okay.
So one of the key things that you have to kind of you know trying to remember the W's here. So anything post-op, this is something you learn a little bit more on step 2, I would say, but it's still, I guess, in a sense, fair game for step 1, more for step 2, but can be fair for step 1. um
Okay.
After a post-op, after post-op, you have your, it's like the W's that can cause fevers post-op. So wind, so anything with your lungs. So atelectasis, pneumonia, right? So that's a one, right? Wind as in W. Another W is water. So you can get, UTIs, things like that. Another W later
Okay.
on is, walking, right? And that mnemonic is for like DVTs that can give you fevers and then end up in PEs, right?
Okay.
And also wound infections are really, really late on, right? So, 6 7 days out when the wound gets infected, right? So wounds can cause fever, so you got to make sure that their wound isn't infected or anything like that, right? And then
Okay.
last but not least, they call it wonder drugs. So any kind of drugs that they're currently on can cause them, like serum sickness and things like that. So 2 days post-op, usually unlikely that it's going to be pneumonia. It's so early on.
Okay.
Okay. I would say most likely, with pain, she's older. So atelectasis is just like collapse of some of those, alveoli, because you're not breathing, right? You're not taking deep breaths in. Okay.
Okay.
And so what can happen is that, it collapses the alveoli. And if I'm not sure if you've spent some time in the hospital yet, but that's why we have something called incentives spirometry, which is you try to inhale as hard as you can, and that's forcing, practically doing lung exercises to try to blow up those alveoli again, right?
Okay.
So that's one of the keys. So bronchiectasis, that's more of like chronic condition, right? That's a very chronic thing. It's not going to happen just
Okay.
surgery. It's usually when, chronic cough, respiratory infections,
Okay.
sputum, right? And that's usually, a lot of the times, smoking and other things can cause that. Pneumonia, right? But usually linear opacity, right? It's not really, they're going to describe it something different, like a lobar pneumonia, right? Or
Mm-hmm.
multiple
Patchy, like they say.
interstitial,
Okay.
right? So diffuse or patchy infiltrate is something you think of.
Gotcha.
Pneumothorax doesn't really make sense here, right? It's going to have, absence of actually lung markings, right? When you have a collapsed lung, right? It's going to just be air. Pulmonary embolism, right? Chest X-ray is non-specific, right? And it's usually normal. If anything, you don't see
Okay. Oh, you
much.
don't see PEs? Okay. I didn't
Yeah,
know.
you not on chest X-ray, not very often, but CT scans, you can see PEs, right?
Okay.
But not too much for X-rays. a lot of times. So yeah, just best answer here is atelectasis. Just kind of remember those W's that I told you about post-operative things that you want to think about.
Okay.